Sickle cell is no longer confined in areas which were endemic of malaria. Right now, it's all over. You can find it anywhere because of intermarriages and so many things. It used to be mostly within Africa or tropical regions, especially those malaria endemic zones. And the speculation, or what scientists believe, is this is an evolutionary trait that the body developed to prevent infection or to limit the infection by the malaria parasite by Plasmodium. Now, let's go to sickle cell itself. We have several types. Today we are going to focus on sickle cell anemia, which usually affects your red blood cells, and it affects there's something that we call HB, which is the constituent of your red blood cells that helps very much to keep the structure of your red blood cells, and also it helps very much when it comes to the transport of oxygen and all that. By now we understand the size of the shape of the red blood cells. It's usually biconcave. It's round and biconcave. I'll try to look for a photo and put it here. Now, when you have sickle cell, what happens is it assumes the shape of a sickle. You know that sickle that you usually use to harvest barley, wheat, rice. When I was young, we used to use that to harvest pasture for cattle. Well, I know it. So if you have never come across that tool, it's an agricultural tool. Look at the crescent moon. The crescent moon, it assumes that shape. So you have two types of people here. You have those, actually let's just categorize them into three. We have normal people. Nothing, they don't have the sickle cell, and the fact that sickle cell is passed down the lineage, and this explains why if you pick someone with sickle cell and then you go down their family lineage, you might find that one of their members was living in an area which is endemic of malaria. So you can really go all the way back to the ancestors. So it's something that's genetical. So you cannot transmit that disease to another person unless you now transmit that to your kids through the genes. When fertilization, you usually give half of what you have. The mother will also give half of what she has, and then you make that one complete. It's very significant, and that's why we have three types. Now you have the first one that we see that person is totally normal, so they don't have that trait. They are totally okay. The HB is normal. Then we have another category of people. They are called sickle cell trait. They have only one gene, which is normal, and another gene, because you need two. A complete set of two so that you are completely normal. But then one of the gene is normal, which now become the dominant one, and then you have another one which is faulty that you inherited from either a parent who was a trait like you, or they totally had sickle cell anemia. So there's a section of the gene that controls how you make your red blood cells and how you assemble them and all that. So that section of the chromosome is what you usually transfer to your kids. So if you have just only one section which is normal, another section, because remember we said you usually get two copies of the same of those genes. So they are supposed to come together and make one complete normal section that usually control the production of the red blood cells and how you assemble the HB, how you use ions and all that, just the production. Let's maintain it at the point where just the production. So if you have only one section which is normal and the other one is abnormal, you have a trait. So you can live totally normal life. Nothing can disrupt you at this point because you have a section which is promoting the production of the normal cells. So you have a huge population of normal cells. At the same time, you're also producing defective cells at the same time because of the other defective gene that you still have. So you are a carrier. So this will not actually affect you at any point unless, although you still have defective cells inside your circulation, but then they are very few, because you have another set of population of normal cells, so they will overwhelm the others. Anyway, let's go to those with sickle cells. And it means that you have both of the genes that you inherited came from parents. Your mother was either a trait or a fully sickle cell anemic person. Your dad the same. So they contributed two genes which are defective, and now you have a complete set of defective genes. So this means that all the cells that you're going to produce are defective. Now you might ask, why is it called anemia? Now Remember, the red blood cells usually contain what we call HB. They are very essential when it comes to the transport of oxygen throughout the body, and also removal of carbon dioxide into your lungs and then out of your body. So red blood cells are usually produced in the bone marrow, and they live for about 3 to 4 months. So that's around 120 days, and from there they get destroyed. Now, a full cycle will be the cell was produced today, and then it goes through the cycle, matures, and then after 120 days, because this is now an old cell which is no longer flexible, it gets destroyed in the spleen, and then that's where you get the bilirubin. We usually go to the liver, get processed, go to your bile. That's what gives your stool color. Sometimes you can get that, and we've talked about that. You can also get that in your urine. So we have a whole cycle of recycling this. So when you have sickle cell, most of the cells are defective, meaning that the spleen is working overtime, because the cells usually go for around 10 to 20 days. They are killed because they are defective. So you produce them and then they're killed. So this destruction of them actually even make your spleen to enlarge, because it's highly involved in killing of the cells. And then now there must be compensation for the same, so you produce more. It gets to a point where now even tired, at this point. So this time the HB of your red blood cells goes low, so it gets to a point where when you go to get your HB tested, you find that you're around 6, 8, around that point. That's very low, and this is the reason. So they are destroyed. It's the natural body process to kill anything which is defective, and that's the work of the spleen. And you have the liver that processes the whatever is left after, just to recycle the red blood cells, in short. So anemia is coming in because of the destruction of the red blood cells, and you're not producing enough to compensate for the same. You get anemic. And this comes with so many things, And now let's go to the symptoms that you feel. I'm going to mix those that usually come as a result of having anemia, and those that comes from the effect of having the sickle cells. So one of which is, like I said, anemia. And this, this is due to the cell destruction by the spleen, which becomes large. And you also have the liver also being overworked. And this is also, the spleen is also the reason why those people who usually get this, not infection, who have this disorder, most probably get frequent infections, because the spleen here is affected. Remember, the spleen is part of it's a step during the maturation of the white blood cells. So if you're not getting a point where they also come to mature, because it's being overworked, that place is overcrowded, so there is no space for them, so you end up having an issue there. And when it comes to specifics of anemia, the headaches, because you're not getting enough oxygen. Sometimes when you move to areas like high altitude area, you become very sick. You have fatigue. Still remember, you're not getting enough of that oxygen, and if you are young, the growth becomes retarded because you're not getting enough oxygen. The HB is what is responsible for that. It's now defective. So if you don't provide enough of the oxygen which is needed for the breakdown, when you're growing, you need a lot of energy, and that energy will require oxygen for oxidation and to produce that energy that you need for the growth and for the work and for the muscles. So you really need that. If you don't have enough of that, it means that you have a limiting factor, and the growth will be affected. We also have, like I said, frequent headaches, because now in the head you're not getting enough oxygen. So that's the reason we usually get mountain sickness when you're moving from a low altitude area, you go to high altitude area. And it means that the concentration of oxygen up there is a little bit lower compared to where you are, so you end up having headaches because of the same. You're not getting enough of that oxygen. There is something that we call pain crisis, and this is very characteristic of anemia. Remember, we said when you have sickle cell, the cells become irregularly shaped, so they are sickle shaped, and also they become sticky, so they're not able to pass through the tiny blood vessels that you have. So sometimes they get stuck in maybe in areas where they branch, or just anywhere where it's a little bit narrow. The reason why your cells are usually biconcaved is because that makes them very flexible to get into any part of the vessel that you have in the body. But then when you have sickle cell, they are sticky, they are not able to navigate through, so sometimes they get stuck. And guess what happens? Behind where we have that area which is blocked, the blood will start collecting. And once it starts collecting there, then the pressure is exerted on that. That's where the pain will come in. And sometimes that pain can be categorically somewhere, just specifically coming from maybe a certain section of the body. And this is dangerous because sometimes that can be in areas or in vital organs, that this will give you sometimes organ failure. It can. But we have ways of managing that, and we're going to look at them later. But then we have frequent infections, like we mentioned, because the spleen is being overworked. The spleen, part of the maturation of the white blood cells will be in the spleen to learn how different things are or they look like, so that next time when they come across something, you can be able to recognize a pathogen from a normal thing. So spleen is very important in this case. So when you have it being overworked, it means that you're going to have very few spaces for the maturation of the white blood cells, meaning that your immune system will be at stake here. And also you have swellings, and this comes to your feet, your hands. For the same, the red blood cells that are defective are not flexible enough, so they get stuck in some areas, and that makes the fluid to collect behind where you have that thing which is blocking. Others will include something like vision, issues with their vision, because you see, you also have blood vessels that supplies the eyes, and they become also affected by the sickle cells. And also we have the major organs, all of them are being affected because they also contain the same. So if you have those cells which are very sticky and bulky and they are not able to flexibly move through the vessels, it means that you're going to also experience the same in those organs, and sometimes that can be troublesome. Another one is gallstones. Remember we mentioned that the destruction of the red blood cells is very high at this point because the cells are defective, so they need to be taken out of the circulation. So what happens is, after the production of bilirubin, and because the number is so high, you get a lot of bilirubin in the blood, and the liver becomes a little bit overwhelmed. So much of that is stored in the gallbladder, and the accumulation of this will increase the chances of you getting gallstones. And also you have priapism, and this is, you see, erection in men usually happen when the blood is forced to your penis. So when the blood goes there, you get an erection. Over time, when you don't need the erection anymore, it falls back. The blood comes out of the penis and then goes to other areas, and it means that now you become flaccid. It falls back. Now, if you have defective cells that are sticky, that are clogging everywhere, they clog some of those arteries and veins. So arteries, it's less common because of the pressure that is involved there. But when it comes to the vein, the pressure is a little bit lower, and it means that they are very susceptible to the clogging. So you clog the vein which is taking blood from the penis, and it means that the blood which is getting there is not going out, meaning that you're going to have an erection which is lasting forever. This is actually dangerous. You can lose the ability to have an erection ever again. So this is that time when you really need to see, if you have an erection which is lasting more than required, you need to go and see a urologist. It's an emergency for them actually. So you need to make sure you have that taken care of. You might lose that erection forever and ever. Now, let's go to diagnosis. How do we know, apart from now the signs and the symptoms that you experience when you go to the hospital? What do they do? The biggest thing is lying in the laboratory where they take blood and it's tested. There are several things. You have the simple ones like just normal HB. They test your HB to see the level, and then from there they start escalating the test based on how they look. Like there's another also a simple test that we call CBC, complete blood count. Sometimes they call that full hemogram. It checks the blood and the cells that you have, the red blood cells, the white blood cells, the platelets, and it actually categorizes. If, for example, it's the red blood cells, we have things that we call indices, the size, the shape, the color, and all that. They help very much to determine the quality of the red blood cells that you have. And also when it comes to the white blood cells, the same thing usually happen. They divide that into eosinophils, basophils, neutrophils, all that, lymphocytes, so that you get to know that. But then here we are going to be interested in the red blood cells and their indices. Now, if you look at the HB, which will be given there also, is supposed to be low. And also when you look at several other things inside there, like the size and the shape of the red blood cell will be altered. Now, there's another test which is corroborative of the same, but this one you look under the microscope. So the blood sample is taken and then put in a slide and then stained and then checked under a microscope. And then this is where you look at the individual cells. You get to see them. How do they look? How the shape or the size and all that. That can point to, do you have a defect here? And also, there is another test which is a little bit more specific for whether you have a sickle cell. But if you have sickle cell, by just checking at the red blood cells, you can easily tell because they'll just assume the same shape. But when you are a sickler, meaning that you are a trait, meaning that you have one defective gene and one which is normal, meaning that you have a population of the red blood cells that are normal, the other population is not normal. There is a test whereby the blood is taken out and then put in a slide, and then there is a reagent or a chemical which is added in that blood that we call sodium metabisulfide, and this one is very, very good. And then the whole thing is sealed using candle wax. And when this happens is after some time, after depletion of the oxygen which is inside there, the defective red blood cells will assume the shape of a sickle. So that's how you know. That's a very specific test. You can also do the same for those who are completely sickle-celled, because sometimes you can have just normal looking cells and then all of a sudden when something changes, like the altitude or the temperature around, the humidity, the oxygen level, when that changes, they also change. And that's where you find that people, when they have that condition, sometimes when they move geographically to another area, they might become very ill. There is another test, which is still an escalation of the same. Now we started with the HB, we went to that test, which is called CBC or full hemogram or complete blood count. And then there is another peripheral blood film where I can actually see the red blood cells. But this time, I want to know the exact HB which is inside the red blood cells. Remember, we have the HB which is associated with the sickling person or the person with the sickle cells. We have the type of HB which is involved in those cells, and we have the normal HB. So what we do is called gel electrophoresis or HB electrophoresis. I don't know whether I'm going to explain it, but maybe you can Google and you can actually see what it entails. Most of the time is you get the HB or the red blood cells, you put them somewhere, and then there is application. This is in a gel, and then you apply current, and then there is a movement of the HB from individual pores towards, you know, we have a positive and a negative side. So the movement across the current area, the gradient there between the positive and the negative terminal. So the distance can easily be able to resolve between the defective HB and the one which is normal, so you can easily tell. So that's very specific for that. We also have other genetical tests that are done, but they are they're expensive, and we have more specific tests which can easily be able to tell us what's going on. So they're not most of the time necessary. When it comes to newborn screening, there are several things that can be used. We have the cord blood, we have the amniotic fluid around the fetus, so that you get to do the screening before the kid is born, and you can easily be able to know whether they are sickling or maybe they are sickle-celled or that. But let's go to treatment, because that's a little bit more important here. There is one thing I want you to know, that yes, we have treatments, but most of them are just to make you comfortable with the condition. We know how it happens. It's actually very hard to treat it, but then there is a cure for the same. And we are going to look at it also, but then before you get there, most of the things that you're going to receive will be to manage the symptoms and to make sure that you don't get the negative effect of having the defective red blood cells. One of which is just having folic acid, which is very important when it comes to the production of the red blood cells. If you're producing a lot of that, if the turnover is very high, that is within 10 to 20 days you have new red blood cells, the best thing that you can do is to help your body make more, because if you don't do that, then the body will get tired, or the HB will keep going low, and you might deplete the resources that are needed to make new red blood cells. So you help the body to make more and more as you continue venturing into the cure. Now we have other things like penicillin, and this one is to make sure that you don't get diseases. Remember, we said the spleen here is very important when it comes to the immune system. So when it's overworked, you're not having perfectly working immune system, and especially if you are younger than 2 years, it's very important for you to be in antibiotics, because remember, this is that time when the immune system is very primitive. So this time you might even exclusively survive on antibiotics, especially penicillin, which is a drug of choice in this case. And also you have the other painkillers that are usually given, the normal ones. You have the NSAIDs for just the mild pains. You remember we said about the pain crisis that comes with sickle cell. Now, if they are mild, you can just use the normal painkillers, the NSAIDs. We have brufen, they're there, you know them. And also we have opioids in case of those extreme pains. You know, you can have pain that extend from several hours to even weeks and even months. You can have pain extending to even 3 months. So yeah, it can be that bad. So in this situation, you use opioids, which is another class of drugs, which is, this is the last resort. You'll have to have that, because the pain will never go away with the normal painkiller, so you'll have to have those in as much as they can be addictive. Another one is blood transfusion. It makes more sense if someone is not able to make normal cells. If you supplement them with new, good and effective red blood cells, they are able to live a normal life, in as much as, that the transfusion has to be a little bit more frequent. And this, in as much as it's a good thing, it exposes them to, we also have, in as much as there are very few, the risks of blood transfusion. But it's a thing. It's you go get new cells from someone, from a donor, and once they give you that, then you are able even to revert the chances of getting the stroke that comes with having sickle cell. There are studies which have even proven that having that blood transfusion can even revert the chances of getting that the heart attack that can be there potentially if you have sickle cell. We have a cure, which is what I mentioned, and this is bone marrow transplant. This is a whole department thing. You see, bone marrow transplant is just like any other transplants. You'll have to do something like called HLA typing. Most probably you'll find that most of whom will be compatible with you are people close to you in the lineage of the family, like your sisters, your brothers, maybe your closest cousins, maybe your parents. Those are people who can be able to provide you with bone marrow, which can type closer to you. So we also have dangers that are associated with that in case of the rejection of the bone marrow. It's something to put into consideration. That's why it's not widely used, but it's a thing. You can easily transplant bone marrow into someone else after killing whatever they have, or you just implant there so that the population of the normal one will overdo that of the defective bone marrow, and then you start producing new population of good cells. Now, you have so many complications in this, in as much as I've seen studies of people having their blood group changed by having this procedure, but of which, if you are treating sickle cell, which is something that is more severe compared to you having a new blood group, I think it's worth it, but it's very expensive, so it's not available to each and every person. Also, the things when it comes to this transplant, it involves long-term intake of drugs that will suppress your immune system so that you don't reject the bone marrow which is transplanted into you. So it's risky, but it's a cure. Okay, while we are still talking about the bone marrow transplant, I remember we had a conversation around the cure for HIV, whereby there was a study of people who had leukemia, and the treatment, they had HIV and leukemia at the same time. And one of the treatment, actually the main treatment that they were receiving that time, is a transplant with the bone marrow or the stem cells of people who cannot get HIV. Remember, we have those people with a mutation in the core receptors that HIV usually used to get into the body. So they had a mutation in that. So the bone marrow of those people are harvested, the stem cells, and then implanted into those people who had HIV and also they had leukemia. So in addition to treating leukemia, they are able to treat HIV, because eventually it follows the same principle. You get those cells into the bone marrow. So when they get there, they start producing new cells, a population of cells that doesn't get HIV. So this means that over time, because now the population will overwhelm the outgoing population, so it means that at some point you'll get cured. So this follows the same principle. We also have another treatment which is advanced, really advanced. This is gene editing. We have something we call CRISPR. So what happens here, or what's happening here, is we edit the gene itself. So we knock out that part which is defective and then replaced with the one which is effective. And it's, yeah, as scary and as complicated as it sounds. So there's a technology, and that's why I really love laboratory. So this is something that has been achieved out there actually on other diseases, other defects, and yeah, so it works, and it has worked in other studies, and this one it can also work on in this one. But then the logistics, the price, the equipment needed, the technology needed is very expensive and out of scope, not actually out of scope, out of reach by the majority of people who usually have the disease. And actually, by the way, we have so many people with this either as a trait or as a full condition, that's sickle cell. I'm sure you heard me mention HSC cells. So this is hematopoietic stem cells. It's a special population of cells that usually give rise to every other cell that you have in your blood. That's the platelets. We have the red blood cells. We also have the white blood cells. They come from those cells. So if you transplant that into a person, then they go and settle in the bone marrow and they start producing new cells. And that's how, yeah, you get a relief from this condition. And then we have genetical counseling, which is more of a protective and more of coping with this than a treatment itself, because if after the test they can be able to determine that you have a possibility of getting a kid with that condition, then they can help you evaluate your options, and from there you can easily be able to make your decisions. I hope that was educative. If you have any question, you can still continue that down in the comment region. We hold a conversation there, or get me in other social media pages. Right now, I'm back. I had a break of I don't know how long, but I was, yeah, you know, I was in other social media platforms. I was uploading there because, you know, just I make some short videos. Here on YouTube, I prefer making detailed long videos, and it takes time. But for those, because I usually travel from one hospital to other in so many areas, so you might find me in a place where it's not conducive for me to make long form videos that you will enjoy. So yeah, I'm back. I'll make so many videos, so you better get subscribed. Make sure you're subscribed and also hit the bell. And I love the pace at which you're going. You're close to getting to 9,000. Yeah. So let's get to 10,000 so that we get to, yeah, I get a bargaining power of bringing the specialists so that you get to even go to their places and get to see what they do and some of that. I've started the logistics of that, so yeah, make sure you are subscribed, because most of the things that you're going to find here are the services or the things that you pay for when you go to those hospitals. So that information is very crucial, and it's usually very, very, you see, when you know exactly what you're being treated, you even have the capacity to ask the right questions, and that's why I usually feel very good when I just come here and educate you. I can talk. So see you in the next video.